Welcome to another National Rehabilitation Awareness Week video as we are meeting the team across the Mary Free Bed system. Right now, we got a special guest. We've got our Chief Medical Officer for Mary Free Bed. We have Dr. Benjamin Bruinsma, who is going to be joining us here in the interview. So, Dr. Bruinsma, thank you so much for joining us today.
You're welcome.
So, you've been at the hospital for quite a few years. You've got a lot of experience here at Mary Free Bed. Why don't you just tell us about some of the many roles you've had on the team here?
When I started here in 1989, I was co-director of the stroke program. A few years later, I became the official director. And a couple years after that, I became the director of the amputee program. And then through the years, I've had some more leadership roles, director of the inpatient hospital, chief of staff, and now I'm chief medical officer.
And throughout all those leadership roles, you've been seeing patients that whole time. So you've been balancing leadership and working with the patients. How has it always been the same types of patients that you've seen over the years?
I'm the director of the amputee and stroke patients. I'm more or less seeing those patients. I do see others, but that's my main focus.
One of the things I like to ask everybody in this video, this is all about educating the public about rehabilitation. From a physiatry view, how would you define rehabilitation?
It's the process of helping someone recover from an illness, injury, or disability. And by doing that, we're improving their function and their well-being.
As part of the team here, we always talk about multidisciplinary approach, just getting all the different aspects of rehabilitation working together. What's it like, and how does physiatry fit into the piece of the puzzle?
Again, we have teams here, and they're nursing. They're going to help the patient stay healthy while they're in the hospital. They're going to teach them their medications, teach them how to do dressing changes or whatever else they need. Physical and occupational therapy, they're going to help them become independent physically. Speech therapy will work on cognition, swallow, speech skills. We have rec therapy, getting the patients back to their hobbies or to their avocational pursuits, getting out in the community. We have social workers who help get the patient the appropriate care after the hospital. And then we, of course, have psychologists that work with them on their well-being. Then as a physiatrist, the physician, we kind of help quarterback all of this, as well as work with the patient and make sure that they are medically stable.
So many of the team that I've interviewed have unique stories on how they got involved in healthcare and especially in rehabilitation. What inspired you to get into the field?
When I was in high school, I was volunteering at hospitals, and I said, I think that would be a good profession for me. And then when I started medical school, there were two people in our small groups that we have in medical school, and both of their fathers were a physiatrist or in rehabilitation. They kind of explained that field. I had no idea what it was, and I said, that's what I want to do, and that's what I did.
And for one more time, I was talking to another physician. I remember hearing that first time I heard physiatry. Like, how would you describe physiatry as a field, as a clinical doctor?
We have two different things that we kind of do. We work inpatient, where we're, again, working on people that have illnesses, injuries, disabilities that require them to be inpatient as they're unable to live on their own at that point. And we try to get them as independent as possible. And then we have outpatient, where we see a lot of musculoskeletal conditions, back pain, neck pain, shoulder pain, things like that.
We're showing some photos of some of the different team that are here, and we're seeing some of the doctors who are working in the inpatient and the outpatient. With your time being here at Mary Free Bed since the late 80s, what's it been like to watch the hospital grow over these years, especially from your side?
Yeah, when I first came here, they just opened the outpatient building. And the inpatient, we had 80 beds. They weren't always full. And now we've moved to the new beautiful hospital, which is great to work on. I think it gives everybody a cheery attitude. And we're up to 119 patients. We'll soon be opening up more beds, so we're able to serve more patients and help them get, again, more independent and help their well-being. So it's been a pleasure working here, and also been a pleasure watching the growth and how we're able to help the community.
Yeah, we're looking at a photo here of the west addition of the hospital that went up in I think it was 13. I think it was 13 was ground building. I think 2016 was when it opened. And we kept the sixth floor of this building shelled. So that was a floor that was not being used at all. And we are in the process of finishing up building that out. So there's another 20 additional inpatient beds that we'll be adding that should be finished being constructed the end of this month. End of September, and then we'll go live to see patients in mid to late October. So, just some exciting growth that we have here. Dr. Bruinsma, now your role as Chief Medical Officer, what is that like being in that type of position, and what are some of like the basic like leadership and guidance you have to have in that role?
Yeah, it's kind of overseeing the hospital and trying to help the appropriate medical care for patients, make sure that the nursing, the therapists, psychologists, recreational therapists, everybody has the appropriate equipment or whatever they need to treat the patient appropriately and make sure that the patient makes progress towards their independence as well as get treated appropriately medically.
This is a really rewarding job working with patients. Working in media relations and helping to share patient stories, it's just so exciting to see those patients as they reach their goals, as they're returning home and just living their life to the fullest that they can. What inspires you and keeps you going to do this job? I mean, this is, many decades you've been here at Mary Free Bed in one community, at one hospital, helping with patients. What keeps you coming to work every day?
I think it's two main things. The first is, of course, helping the patients. They come into us in a state where they're unable to live on their own. And through the time and dedication of our staff, we're able to make progress and get them as independent as possible. So that's the main reason I come. The second reason is this is kind of a big family. We're with each other, the therapists, the nurses, everybody's working here, maintenance, housekeeping, and we're kind of all a big family. You walk down the hallway, how you doing, how are your kids? And it's kind of a home away from home. And I think that's another reason that it's fun to come here. I just spoke with a physician who's getting close to retiring. And what he told me is he kind of wants to get rid of all of his practice, which is more outpatient practice, except he wants to come to one clinic here twice a month because he has so much fun. So ready to retire, but he doesn't want to get rid of that clinic because he's having so much fun.
We're showing some pictures of our staff with the U.S. News when we were ranked top 10 in the nation. How does that feel to just know that we're starting to get more and more national recognition for the work here? And we know that we're one of the best in the nation, if not the world, but now to have an outside organization to say that about us as well. How does that make you feel? And how do you think the staff feel for all this?
Well, that makes us feel great. We always knew we're one of the best, but now getting the recognition and then getting the accolades, which I think the staff deserves, the therapists, the nurses, everybody that's working at Mary Free Bed, it's the congratulation for the hard work they've done, which of course is helping the community and the patients that we serve.
Well, Dr. Bruinsma, I want to thank you so much for chatting. As we're wrapping up this interview, we are celebrating National Rehabilitation Awareness Week. Why do you think it's important to celebrate the field of rehabilitation, but also just to celebrate our staff?
Rehabilitation needs celebration because, again, it's getting the patient through the process of injury, illness, and disability, getting them as independent as possible and improving their well-being. And again, we're a top 10 hospital, so we're doing well. And I think it's good to celebrate that because we're helping everybody. And then, of course, I think it's great to celebrate with our coworkers who are helping us achieve those goals. And I think everybody here thinks it's a great place to work. And again, seeing the outcomes of our hard labor is fantastic. And again, I want to congratulate and celebrate with everybody for that.
Well, Dr. Bruinsma, thank you so much again for joining us. Chief Medical Officer here at Mary Free Bed Rehabilitation Hospital. This has been another video in our series of Meet the Team for National Rehabilitation Awareness Week. We've talked to physical therapists, speech language pathologists, physiatrists, recreational therapists, just all types of people from across our network and system across Michigan, educating about rehabilitation and just celebrating our team. So if you missed any of those videos, jump back in your social feeds to check it out. And we really appreciate you and our community for celebrating rehabilitation.